Well, hello, fellow pet lovers. How in the world are you today? Today, we're going to be talking about killer kennel cough and the importance it is to stop the cough, especially in small dogs. Let's get started. This mystery infection is spread across the United States. It started in the Pacific Northwest, moved to Southern California, moved everywhere, is creating a significant health risk for all of us dog owners across the states. The symptoms are dry, harsh, hacking cough coming out of nowhere. Patients initially are sick and then start developing pneumonia if it's allowed to progress. So, what's serious about the infection in small dogs, you ask? Little dogs create big problems when it comes to potential debilitating illnesses, long-term, intermediate term, and especially if they develop acute pneumonia. The problem is their little bitty windpipes, their trachea is little bitty, so to speak. The windpipe in a Bernese Mountain Dog, which I'm the proud owner of a mini flock of Bernese Mountain Dogs, is about that big around, very sturdy, very stable, cartilage with some little flexibility in it so that we can breathe in and breathe out. The windpipe in a Chihuahua or a Pomeranian is smaller than the diameter of a Bic pen. And it's not as sturdy, it's not as rigid, it's not as resilient to injury as it is in a bigger dog. And the problem is we end up with a condition called collapsing trachea all too easily. And the reason for that is cough begets cough, because the more they and the more strain that happens within the windpipe itself, you have something called physics, and that physics is a pressure gradient that occurs during inspiration and expiration. The windpipe will start contracting up and down and up and down, and you start getting mobility. And when that mobility becomes pronounced, the patient can't breathe. If we look at a radiograph, you'll notice where these red lines are, the windpipe is narrowed between those two segments. And the windpipe is the black structure in the middle and bigger on both ends of that red, which is 100% normal. This is a 12-pound Pomeranian, and he has airway problems and a big difficulty breathing, which we don't want to have happen. In these patients, cough begets cough, and I can't emphasize that enough. So what significant medication to reduce that cough has to be implemented in the early stages, because the more they cough, the more likelihood you're going to end up with this type of problem inside their chest. And when that occurs, it's pretty much not reversible. It's just not reversible. When that windpipe is started wiggling up and down, it's weakened and it doesn't want to come back. And if this is happening in a 2, 3, 5-year-old kid and he's supposed to live to 18, living to 18 probably isn't going to happen if that windpipe is making mobility changes like we see.